Hello and welcome to another episode of the Your AKT Podcast, which is hosted by WellMedic.co.uk. In this pod, we will cover some aspects from within the rapid, NICE guidance created for COVID-19. Now, you are reviewing an 80-year-old gentleman in the community with a 4-day history of fever and lethargy. He has a background of congestive cardiac failure, which is relatively well controlled. The patient is frail and is dependent on carers twice daily to help with his medications and many of his ADLs. The patient has tested positive for COVID-19 and is being reviewed at a COVID hot site clinic. On examination, his respiratory rate is 20, his heart rate is stable at 75 beats per minute, his blood pressure is 115/60, and his oxygen saturations are 95% on air, which is relatively stable for this patient. He is also apyrexial with a temperature of 36. The patient has distinct crackles isolated to his left lower base. The patient has no known drug allergies. And the question is, how would you manage this patient? So in order to break down the scenario, we have a COVID-19 positive patient who is now demonstrating signs and symptoms of a lower respiratory tract infection. The guidance, as we expect, would suggest that antibiotics are actually ineffective in treated COVID-19 pneumonia. However, there are some considerations where the use of antibiotics would be indicated. Now, there are 3 categories under which prescribing an oral antibiotic can be used in the community. Let's say there is some ambiguity as to whether this is a viral or bacterial cause, and I guess in itself that's rather woolly. And the second caveat to that would be whether or not you feel the likely cause is actually bacterial. And finally, and probably the most telling part of this guidance is linked to the scenario where the patient is at high risk of complications. Now, this accounts for older or frail individuals and those with significant comorbidities such as immunosuppression, significant heart or lung disease, or if they have a history of severe illness following a previous lung infection. Now, the second part of this scenario would cover the choice of antibiotics. So in this scenario, where the patient has no known drug allergies, we'd often opt for amoxicillin as the first-line antibiotic in a pneumonia. However, the difference in this case would be that the first-line antibiotic should be doxycycline. And that's because it's preferred first line because it has a broader spectrum cover than amoxicillin, and particularly against Mycoplasma pneumonia and Staphylococcus aureus, which are more likely to be secondary bacterial causes of a pneumonia following or during the COVID-19 pandemic. I hope you found this useful. It is very topical indeed with the current COVID-19 situation. And please do, as always, share this podcast with your GP colleagues. Thank you. This podcast is hosted by WellMedic.co.uk. We help GP trainees pass the AKT.